Rare skin condition gives 9-year-old girl skin like K-pop demon hunter's character. Medical Mysteries is a series that spotlights rare diseases or unusual conditions. 9-year-old Fu Hu was diagnosed with Neurofibromatosis type 1, NF1, after experiencing pain and displaying kpop late spots. NF1 patients need regular monitoring due to a higher cancer risk, up to 40% by age 50. According to Dar Chiang from NEX, Phoebe is managing her pain and tumors with selumetinib and receives multidisciplinary care, including psychological support. Singapore, where the marks on Rumi from Netflix animated film K-pop demon hunters are purple. Those on 9-year-old Fu Hu's arms and body are light brown. As a result, she is often bullied in school, with her schoolmates making unpleasant remarks about her skin. Often called kpop late spots by doctors, the flat, light to dark brown birthmarks that resemble coffee with milk on Phoebe's skin are the underlying signs of a genetic condition known as neurofibromatosis type 1, NF1. NF1 causes changes in skin pigment, including flat, light brown spots and freckles on the armpits and groin. It also causes the growth of benign, slow-growing tumors that develop on or under the skin from nerve cells. These tumors, called NF tumors, can appear as soft lumps throughout the body. Phoebe's condition was discovered when she began having pain behind her left ear around March 2023. Her mother, Perlin Go, 42, said. She was brought to Cake Women's and Children's Hospital, EC, and MRI scan, 3 doctors, and a genetic test later. Phoebe was diagnosed with NF1. Apart from the brown spots on her arms and parts of her body, the scan also showed that Phoebe has a tumor behind her left ear and another near her brain stem, Madame Go said. She told the Straits Times that her research revealed that children with NF1 often have special needs related to learning, such as difficulties with attention and memory. However, Fu does not exhibit these difficulties, which is a relief, she shared. Darniki Fong, a geneticist with CAC, explained that there is a 50% likelihood of NF1 being passed on if one parent has it. It can also occur spontaneously from a new gene change, she said, referring to what is also known as gene mutation. The kpop late spots on 9-year-old Fu Hu's arm made her a target of bullying in school. Photo. Hester Tan. Subsequent investigations revealed that Phoebe's father, James Hu, 43, a taxi driver, also has the condition, though his was not inherited from either of his parents. Like Phoebe, Mr. Hu has the kpop late spots only on his arms, legs, and body, except for this large lump at the back of my head, which is a benign NF tumor, he told Street. As I did not know what it was not detected until adulthood, he added. According to clinical assistant professor Chiang Jianbang from the Cancer Genetics Service at the National Cancer Center Singapore, NEX, the adult patients seen at NEX typically fall into one of 2 categories: those who were not diagnosed during childhood and those who, despite an initial childhood diagnosis, did not pursue follow-up care as they grew older. Dr. Chiang said that as young NF1 patients transition into adulthood, they often feel capable of managing their own health and symptoms, leading them to believe that regular follow-up appointments are no longer necessary. He said that it is important for NF1 patients to be regularly monitored as they are at a higher risk for hypertension and various cancers. By the age of 50, the risk of cancer in NF1 patients can be as high as 40%, compared with the 5% in the general population, he said. Treatment for NF1 focuses on supporting healthy growth and development in children and early management of complications. Dar Enrica Tan, a senior consultant with the Hematology and Oncology Service at KEC, said Fu was also in a lot of pain, and the pain was making her sick. The painkillers she was previously prescribed were not effective and also impacted her appetite. Phoebe is now prescribed selumetinib, a medication that treats the benign tumors, called plexiform neurofibromas, in children with NF1. It stops the growth of the tumors and shrinks them, improving pain and other symptoms. She is good at taking her meds and takes them like clockwork. She wakes up early to ensure she takes her medicine at 6:45 a.m. before school on weekdays, and at 7 p.m. On weekends, she wakes up a bit later and takes them at around 9 a.m. without prompting, Madame Go said. Pediatric dermatologist Valerie Ho, a senior consultant at KIG's Department of Dermatology, manages Phoebe's skin condition, as there is a need to monitor closely for potential side effects from the medication, such as dry skin, eczema, and acne. As Phoebe grows, she would have to be monitored for other manifestations of the condition, such as scoliosis or the curvature of the spine, one of the more common deformities of ENF1. This is why children with ENF1 need to be managed by a multidisciplinary team, which also includes a psychologist to manage the psychosocial impact of the condition, she added. Madame Go explained that to help Phoebe understand that apart from her father and herself, there are others who also live with ENF1. The family attends events organized by the Neurofibromatosis Society, ENFS, Singapore, and by KEC. ENFS is a new patient-led group formed to support individuals with neurofibromatosis. There, she has made friends with other children who have similar spots to hers. At least she knows she is not alone in this fight against her own demons, her mother said.